you all look amazing. The view from up here is amazing. All of the hard work that we have done to get here is paying off big time. 2015. It is paying off big time. Because you know what? They told us we would never be here. They told you you would never be here. But are you here? Are you here? Tell them that you're here. Let them know that you are here. That's right, we are here. Yes. Hey, Doc. I'll see you later, I promise, okay. So, right before we broke for lunch, we heard from our executive international secretary treasurer, Mike Fishman, about our VUCA world, right? This world that is more and more volatile. It's uncertain, it's chaotic, it's ambiguous. And in order to thrive in this changing world, we need to become a 21st century organization. And one way that we're going to do that is by embracing technology. And we're going to embrace technology with all that we have. How many of you all have downloaded your 2015 app? Let me see your hands. Right? How amazing is it that we have our very own app? And it's being launched here today at our Leadership Assembly. If you have questions about the app, make sure you stop by the Cyber Cafe downstairs. And just to give you all a little teaser of what this app can do, it's going to tell you about upcoming meetings in your region and in your town. You'll be able to read the latest union news. You can send an email or call the MAC with the app. You're able to interact with the 2015 Facebook and Twitter feeds, and you can even track your work hours. How about that? I know how hard it is for IHSS providers to track your hours, and with this complicated overtime system, now you'll have the app to help you out. How awesome is that? Coming soon, for you nursing home and private agency workers, there's going to be a journal feature. So when you have trouble with that supervisor, you'll be able to make note and send it right to your organizer. That's great, right? Yeah. Also, very, very important, right now on the app is a survey. Our Constitution and Bylaws Committee has been really hard at work putting together proposals for what our new Constitution and bylaws may look like. But we need your input, right? All of our members need to have a voice in what's in our Constitution and bylaws. So please download the app so you can take the survey so we can hear your voice about what our governing document should say. So don't forget, download the app, go to the App Store if you are an iPhone user, or the Google Play if you're an Android user. And don't forget the Cyber Cafe is downstairs. So this VUCA world, it's volatile, it's uncertain, it's chaotic, it's ambiguous. But we're gonna meet VUCA with our own VUCA. We know that we can have vision, right? We can meet that volatility with vision. We can meet the uncertainty with unity. We can meet the chaos with clarity. And we can meet the ambiguity, that's a hard word. We can meet the ambiguity with agility. On our listening tour, we met members from all over the state who know firsthand what happens in a VUCA world. You all know how hard it is to find an affordable place to live. You know firsthand the impacts of the drought and wildfires in your community. You are angry over the incarceration that is breaking all of our families apart, especially amongst young men of color. And you all know far, far too well how hard it is trying to make ends meet on $10 an hour. Yes, ma'am, right? I'll say that again. You all know how hard it is trying to make ends meet on $10 an hour. Amen. But more importantly, you all shared your hopes and dreams for a better future, not just for yourselves, but for your families and for your communities. And that is what we are going to build this great big house that LaFonda talked about this morning to do, to make sure we can all together realize our hopes and our dreams. So this afternoon, we're going to get a bit more educated about these issues that are important to us. Issues like environmental justice, criminal justice reform, affordable housing, and the future of our work. We're going to have panel discussions on a few topics, and we're going to move to our first one now. We've invited experts to help us better understand these issues and how we can be a part of the solution, and how a 21st century organization can address these issues that are plaguing our communities. Our first panel is on the future of work. And to help me moderate that panel, I'd like to bring to the stage one of the best member leaders I've had an opportunity to work with, Guillermo Vasquez from Los Angeles. Come on, Guillermo.
So how are you doing today, April?
Oh, I'm great today. How are you?
I'm wonderful.
Awesome.
Thank you guys for being here today. I'm very blessed to be up here. And so, April.
So we're going to bring out our panelists now. First, we have Martha Smith, who's the Chief Program Officer with HealthNet. HealthNet is a managed care organization here in the state of California. Thank you. Welcome, Martha. Mike Townsend is COO and co-founder of the app-based service provider Home Hero. And last but not least, Daniel Bustillo. Daniel is the research and policy analyst for HCAP, which is the Healthcare Advancement Program. HCAP does work around workforce development and training for healthcare workers nationwide. Welcome, all of you. Thank you for being here.
Thank you.
So we're going to start by asking each of you to take a few minutes to talk about the work you do and how our local can be a part of it.
Thank you, April. As you heard earlier, 10,000 Americans are turning 65 every day. And this is something that is very near and dear to me because this is something that's going to affect all of us. With that, California's senior population is expected to explode in the next few years, also known as the silver tsunami. The question is, how does this impact the future of our work?
So please, Martha, let's start with you.
Sure. So I'm Martha Smith, as I was so kindly introduced. I work for HealthNet. HealthNet is a big health plan in California. We serve about 3 million people in California. 2 million of those people are beneficiaries of either a Medicare program or a Medi-Cal program. So my company is really committed to serving the older population as well as the underserved population. My particular passion is around serving the Medicare population and people who have been underserved in the past through our medical system. So what I want to just mention or want to talk about for a minute is kind of where we've come as a healthcare delivery system and where I think we've got the fantastic opportunity together to go. I've been in the industry for 30 years, and what I've seen over the years is that in the past, the medical system, which is what my company does, medical system, has been pretty isolated and not really had a great awareness, quite frankly, of how to better integrate with the long-term care side of the world. I mean, the medical system writes prescriptions, does hospital visits, and takes care of people in the doctor setting, but hasn't had a good sense of what goes on in the home environment and how can we work together better to make the patient population healthier. So I think that the fantastic opportunity that we've been afforded right now is that there's a growing awareness of that disconnect that has occurred in the past. And things like the CCI, the Coordinated Care Initiative, and the CalMedi Connect demonstration, those are examples of really new and innovative programs to put programs together to incorporate and better integrate the medical system and the long-term care system. So my whole focus at HealthNet is about how to create programs to make that work better. The fact that I got to be here today, thank you, is to me an indication of that we have that opportunity now. I've been able to work with LaFonza and team to try to put together some pretty innovative new programs and demonstrations to incorporate the IHSS workers into the care teams that we deliver as part of the healthcare delivery system. And so I feel like we've got a tremendous opportunity together. Growing awareness is the key on our side, and we've got to do a better job of educating the medical system on how to better incorporate long-term care. So I just say thank you for letting me be here and be part of this conversation today.
Thank you, Martha. And Mike?
Sure. Thank you for having us here. Mike Townsend. I'm the founder of Home Hero. Based in West Los Angeles, Home Hero is a service to help families find caregivers and work through the senior care experience. We started the company about 3 years ago, really with the vision to not only help families, but help caregivers, long-term caregivers for seniors, find work that best fits their needs. We recognize through a personal story of trying to find care for my co-founder's grandmother, who is 98 years old in Seattle, that it's extremely difficult through manual processes of kind of word of mouth to find someone that's a really good fit for your family. The interview process sometimes is difficult for families, and often the match that both caregivers and families have together is not ideal for the area that they live in. There could be a better family to work with right next door, but due to lack of communication, you wouldn't necessarily know that. So when we started the company with Home Hero, our vision was, could we use technology, use software and the mobile apps that we all have in our pocket to better connect families with caregivers? Could we say that you as a caregiver could go in and create a profile and set your availability and your schedule and your background and what you'd hope to accomplish in your career and the distance you'd like to travel, everything specific to you, to then connect you with a family who's looking to hire someone nearby. And essentially by making that process much more efficient and easy, we can better connect families and caregivers, thus giving people better access to jobs that hopefully attract new people to the profession, and then also pay them higher because the families have that better connectivity. So we're really inspired by events like this, and I personally have a huge passion for helping caregivers and just workers in general better connect with and work with families. So again, just super excited to be here today.
Great, thank you. Thank you. Daniel, please.
Hi, so just to echo the fact that I'm really excited to be here as well. Thank you so much. A couple of things before I start to make a remark. So my name is Daniel Bustillo. I'm a researcher and policy analyst with HCAP, which is a national labor management cooperation organization of SEIU union locals and their employer partners from across the country. So before I get started, there's a couple of things. There's one thing I have to say, because if these people find out that I did not say it, they would not be happy with me. So my grandmother, who is no longer with us, but whose spirit resides in me, when she came to this country from Cuba, was a long-term care worker. So she would want to send greetings. My mother-in-law, when she came to this country from Haiti, she was a long-term care worker. So she also would want to send greetings. So I just want to extend greetings from them to all of you.
Thank you.
Thank you.
So just really quickly, and this as someone who has benefited from some of these career pathways as a former healthcare worker that have existed in healthcare, I had to script myself today because this is something I could talk about for a long period of time. I get excited about it, right?
Yeah.
So thinking about, there's three things that I really want to talk about, 3 points that I want to leave you with. Thinking about what's occurring within our healthcare delivery system, right? If we're moving to a delivery system and thinking about where we are with the future of workforce development and long-term care, if we're moving to a delivery system in which sort of Earlier identification and intervention can prevent expensive emergency room visits and hospitalizations, which reduces costs. There's no way we can get there without the long-term care workforce being an essential component of that, without all of you being an essential component of that. So we need to do the work of sort of improving the quality of jobs and helping provide workers with the support and skills that they'll need for a transformed system. We can't transition to population health, community-based forms of care, without proper support of the long-term care workforce, right? So what does that actually mean? That means better and more workforce training and support in long-term care on things like transitions in care, integration into care teams, training to deal with the increased acuity of consumers, residents, clients, behavioral health training, the use of technology, culturally competent care, and more, right? We also need to better understand what are the roles and jobs that are coming forth in the transformed system in long-term care. We need to push to incorporate models of training, such as competency-based ones, that are better for working adults, that work better than traditional models of training. Second thing is we need to do the work of creating better career advancement opportunities and pathways in long-term care and for long-term care workers, right? We need to do a better job. Those people who do workforce development work need to do a better job of figuring that, what that looks like. It's particularly important as we sort of think about envisioning the new jobs that will be created in long-term care as we move toward a transformed healthcare delivery system. So traditionally, career pathways, when we think about that in healthcare, that has traditionally meant people leaving long-term care. We need to think about what that would look like if that was not the case, right? What are the career pathways outside of long-term care, but inside of long-term care as well? If long-term care workers, if you all choose to pursue career pathway and advancement opportunities, then you should be much better supported in that pursuit. And the last thing I want to say is we must provide value back to you all, who are providing value to the healthcare system. So what does that mean? You're creating value to the healthcare system in the form of cost savings by keeping people out of the emergency room, out of hospitals, readmissions. A fair share of that value should go back to you in the form of increased wages. All right? You all, right? So you all have done the work, right, of accessing training and workforce opportunities in order to increase your skills to care for consumers, clients, and residents with complex care needs, right? You've done the work of helping to create savings, and you should be rewarded for that.
Yeah, that's right. Thank you.
Exactly.
So, in a second, I want you all to be thinking about the questions that you may have for the panelists, because this is you all's assembly, and we want you all to have an opportunity to ask questions of the folks that's up here. So I'm going to come back to you in a second, but be thinking about those questions, okay? So Guillermo, do you have a question?
Yes, I do. Thank you, April.
Thank you.
First off, real quick, before I ask a question, I want to say thank you. It's refreshing to hear like-minded people outside of us, as, you know, this isn't just our fight. There's other people who are involved, and I want to thank you personally from the bottom of my heart. So my question is, looking ahead, as we've been talking about, looking to the future of not just unions, but the future of medical care. What do you see as being future opportunities for our organization to impact the delivery of long-term care services?
I'm happy to start. So I started out by saying I think that there's growing awareness inside the medical community of the value of what long-term care and IHSS means to the medical system. I think that what we need to do collectively is lobby for more opportunities for integrated programs. When we get a chance to do those kinds of pilots and integrations, it gives us the opportunity to do the things that Daniel mentioned. It gives us the opportunity to say, okay, if we're going to save money from preventing hospitalizations and other kinds of care that is potentially harmful to our patient population, how can we share in those savings? What's the way to do that? Unless we've got integrated programs that we've been able to lobby for together to do that, it makes it really difficult. If long-term care workers sit over here and the medical system sits over here, it's really hard to figure out how to put the two things together. So one thing I think we need to do collectively is continue to lobby for better integration. And part of that, I think, means that we're looking for ways to incorporate technology into how we communicate. One of the things that the medical system lacks is information about the patients and what's happening inside the home. There's no one better than home care workers to help us know what's going on, who are the eyes and ears and seeing the patients that we treat every single day. So providing a vehicle or an opportunity to get that information into the medical system, into the care teams who are trying to navigate for our patients, the use of technology is really going to help us get there. So taking opportunities that are presented to do that, I think, is a second thing that we need to do. So better data exchange. And then the third thing is education. And what I mean by education through the lens of a health plan is two different things. One is we have to educate the medical community about how to better integrate systems. They frankly aren't as aware as they should be. So it's our job, I think, to make sure that the medical system is educated about the value that is afforded to us by all of the home care services and home and community-based services out there, and get them the information in order to be able to better manage care. But then also provide opportunities for education for home care workers so that there's a way that you know how to talk to the medical system too. So I think education is kind of a two-pronged thing. So that's what I think is the opportunities ahead of us together that we can make the system better.
Thank you, Martha. And Daniel, I would love if you could connect the dots for us for what Martha mentioned as the role she sees for home care providers, and how our organization can assist in making sure home care providers have the skills to provide the input that Martha's talking about.
Yeah, no, that's a great question, April. And I think that, so thinking about the fact that, so I was thinking back to what was talked about in the beginning when your President LaFonza Butler talked about 350,000 members. So thinking about what a tremendous opportunity that is in terms of what you're doing here, thinking about, frankly, connecting the dots around workforce and education. Oftentimes when we think about education systems and things of that sort, they're not necessarily the friendliest to working adults, right? So we're thinking about forming partnerships where we have some of the things that have been talked about, April, and the educational systems are not necessarily the friendliest to working adults. So with the density that you have here, thinking about the opportunity that you really have, and I'm really excited about it, the opportunity to create systems in partnership with what you're talking about, Martha, right? In partnership, thinking about the opportunity to create systems related to some of the needed skills and competencies, what some of the new roles might be. You have not only the opportunity to create better educational systems, but also thinking about it in the context of playing a role in shaping what that might look like, right? So working together to determine what it is that might look like and what works best for all, I think you have you have an exciting opportunity here to do so. I mean, frankly, thinking about career pathways and advancement in long-term care, there has not been good work done in that realm, right? That has not been done. So there is an opportunity to really think about what that might look like and what is needed and what those new roles might be, and to do that work and be a leader in doing that work, not only in California, but nationally.
Thank you. Mike, a question for you. I love the fact that it's Guillermo that's sitting here for lots of reasons, but what would you say, being the cutting edge, guy who developed this app that's about connecting workers to people who need them, what would you say we can do to help attract the Guillermos of the world? I would dare to say folks who are entering the workforce, who are between the ages of 18 and 25, are not thinking about being a long-term care worker. But we need more Guillermos thinking about being long-term care workers. So what would you say we can do to invite more young people into the long-term care workforce?
Yeah. I'd almost take a step back and say, why is that? Why fundamentally do you believe that the younger generation is not attracted to this profession? And I think getting to that root cause, what is it about the long-term care work experience that you're alluding to that's not attractive. And I think finding that out and addressing that and trying to fix it, it may be in some part technology. You know, there could be some degree that could help, but I think it really is going to involve leaders stepping up, being proud of what they do, you know, being proud of the work that they fulfill, and attracting other people to it, you know, because when you're young, you generally have a world of opportunities. There's many different directions and career paths you can go down. So thinking about long-term care as an opportunity for you for the next, you know, 5, 10, 20 plus years is one of many different career options. And the world's an exciting place. You know, there's a lot of different, you know, especially when you're young, there's a lot of different careers you can go down for people. You know, just as a side note, I'm particularly excited about education, and education not just within one sector, but knowing that the top Ivy League schools, Harvard, Yale, Princeton, Stanford, they all publish every course that they have with video lectures and quizzes and exams online for free at OpenCourseWare. And this is something that those schools have taken as an initiative to teach everyone across the world that has, you know, access to internet. And I think that same application of education should be applied to long-term care. Something like what Daniel alluded to, there should be better systems for learning how do I do better at my job, how do I get better recognized and connect to people and sort of be proud of what I do. So I think developing that culture of pride is fundamental to attracting the youth to the profession.
Thank you.
Let's hope for the future.
That's right. So let's go to quad 1 and see if there is a question. If you have a question, let's come to the mic that you're closest to.
The more questions, the better.
So for those of you who are thinking about your questions, if you want to get to a mic, that would be great. I got you.
Good afternoon to the panel. I'm Gregory Fields, and I am a caregiver. I'm going to ask the question that all three of you can actually answer individually. Starting with the medical piece, what consideration have you given to creating a format that would allow you to broaden the information given from the medical piece to articulate the positions that caregivers provide so that you can get more funding coverage, number one, which is in furtherance to what appears to be the gentleman in the middle's position as an agency, or registry, should I say, that connects the caregiver to a database that matches them to people who need the particular care. In addition to providing information to the third gentleman's database so that the medical professionals who receive the request for IHSS recipients will have a more broader document that is completed that spells out to them specifically the care that the recipient is in need of, as opposed to the current elementary form, which is a multiple choice document.
Wow, that was a lot there.
Okay.
All good.
So do one of you...
I can walk you through it, but I hope you got it.
I think they got it. I'll let
Okay.
one of these really smart people answer that question.
Well, I'll start. If I don't get to answer your question, you can hit me up afterwards and see if we can do that. But so I would say I'll give two quick examples. One is around the CalMedi Connect program, which is the duals demonstration, right? So one thing that we've done there is we've taken the good news is, because it's a demonstration, we got access to an awful lot of data that we've not had in the past. So we got IHSS assessments, we're getting a hold of all of the numbers of hours of support work, all the information around home and community-based services, et cetera, that has, again, not been available to the medical community. All of that information, we created a portal where all of that information is uploaded and put into like a care plan format for the doctor's office to be able to look and see a comprehensive picture of all the services rendered and the IHSS hours authorized, et cetera. So now when there's a conversation around, well, this patient's going to be discharged from the hospital, we need to make sure we arrange for more support in the home setting for a 2-month period or whatever that might be. That data is now available where it wasn't before. So that's one way that we're starting to look at that. Like, as I said, the new opportunity we have in front of us is things like that. The second is that we created a pilot program in partnership with SEIU in the long-term care education program, or long-term care education center, where we do kind of a mini training, a mini education program around how do you interact, how does an IHSS worker and their consumer interact with the managed care world? Because we're a different animal, I think, to a lot of people, and we can be, the medical system is complex. So we created a mini education program on how can we interact better together, and then we set up a system for the IHSS workers to contact us and be part of the care team. So you're an actual member of the care team, assuming that that's what your consumer wants. And so that we've created a better vehicle for communication in that pilot program. So those are 2 examples of things that I would say are kind of a step ahead of where we've come from in the past. And from a technology perspective, I think there's a lot more opportunity, but those are just kind of two small pieces.
Thank you, Martha. So before I move on to the next question, I see all of you all are lined up at these mics, and that's great because I can see the wheels turning in our heads. But I'm telling you now, we are not going to have time for all of your questions. Sorry. And I don't want you saying, but April, you said you was going to answer my question. So I'm going to do another plug for our app. Since we won't have time to get to all of your questions, if you download the app, you can submit your question through the app, and we can make sure we get an answer for you, okay? So I really don't want to hear. Or you can use the old-fashioned way and just email it, or even more old-fashioned, write it down and hand it to one of the quad leaders. And we will make sure we get back to you on your question. All right? Sounds fair? Yes. So, to the gentleman up front who's been waiting so patiently.
Copy
that. Good afternoon, panel. My name is Richard Hammond, and I'm a consumer. And if it weren't for my IHSS workers, I'd be in a nursing home. Keeping that in mind, my question is, how do you plan to go forward and not forget about the recipient? I mean, I want my IHSS workers to make as much money as they possibly can. I think what they do for a living is amazing.
Thank you.
Thank you. Thank you, Mike.
They don't deserve or get the respect that they deserve. They do. My IHSS workers, now that I have them, I have no more pressure sores. I'm not going to go into detail, but all of the bad things that can happen to people happen when no one cares.
Sure.
Right.
So what are you going to do to fix it?
Sure. The first thing that immediately comes to mind is when you say that the workers don't necessarily get the respect they deserve. I think of stories, and one story that immediately comes to mind is last June, 40,000 workers in Los Angeles didn't get paid, not only not on time, but months and maybe not even at all later due to a mail truck mishap. 40,000 timesheets were lost in the mail, basically. These are paper timesheets submitted, and upon submission, something happened in the mail and they didn't get paid. People didn't get paid for months even. And the expectation is 19 days. Between submitting the paper, it getting approved, it getting entered in a system, checks getting approved, checks getting mailed out. And I look at, wow, it takes 19 days for you to get paid. That's pretty bad. And I think about what could improve that sort of respect. And part of our initiative with Home Hero is with long-term care workers on Home Hero, they get paid the same day. At worst case, they get paid the next day. And the reason we do that is not because we're nicer. As much as I love the caregivers, it's because we built, through payment technology, the ability to pay people the same day or next day. And I look at that and say, that fundamentally just makes people happier. It makes you live a better life when you can not only get paid, not 19 days later, but next day. And I think if you start to add up those experiences, change it, and make it better for people. Money is a very important thing, speed of getting payments, but also things like recognition. And I think if you look at how to get recognized, there's in person, you can say to someone, congratulations or great job, but then there's also the form through emails. Your family could email you. It could be a Facebook post. I think there's many different ways that we feel proud about what we do, and sort of broadening those is what Home Hero is about. We're very engaged on social media. We're very proud of all of our caregivers that work with us. So I think continually going down that road is really important.
Thank you, Mike. Is there a question from Quad 2?
Good afternoon. My name is Teresa Heinzman. I'm from Regional 4 from Sonoma County. My question is to the man in the middle when you say about our young people. If we don't pay the money for our young people, we're not going to have long care workers at all. You have to make this job very important to them to come into the long care as worker. So I'm saying if we don't get the money they're getting, they're not going to be here. Then all our older people is going back into the nursing home, and then where else they going to go?
Yes.
Thank you.
Thank you. Thank you. We do have to make sure that long-term care work is rewarded, right? Not just in people feeling good about being able to do a job well done, but long-term care workers should and must earn livable wages where you all can take care of your families and provide for your communities. Yeah. Yes. So we have time for one more question. I'm going to go back to Quad 1.
Mike.
Good afternoon, all.
I can't see around the corner. Is there someone over there?
Hi, April. This is Bradley from San Francisco,
Hey,
Region
Bradley.
5.
Hey, Bradley.
And given that we have an opportunity and a need to respond to the governor's budget, where CCI, the Coordinated Care Initiative, which is the integration of long-term care into the medical program, is somewhat under attack because the governor has said he's only for funding it for one more year. And we need a coordinated political and educational and community, long-term care community campaign to spread the idea of the importance and the goals that we all share and have together to counter this so that we can count on continued expansion of CCI and the coordination between long-term care and the healthcare industry.
Sure, I'm gonna let Martha take that question, but before you go there, I will say to all of the IHSS providers in the room, we will not sit still and we will make our voices heard in Sacramento and all across the state of California that we want IHSS fully funded, right? We want our 7% restored permanently, and we don't want our CCI funding tied to anything. It needs to be a part of the general fund. And we're gonna keep stopping up and down this state, making sure that message is heard, right? Right?
Right.
Right? Okay, Martha.
Well, I missed your name
His name is Bradley.
Bradley. So I could not agree with you more. And as a health plan representative, I think I speak for all of the plans who are participating in CCI today. We're with you on that, that intent and that desire to lobby for expansion of CCI and longevity, because we have seen the value of putting the programs together and better integration for the betterment of the care for our patients. So I think that the great thing about the future is at least we're aligned in our goals and all of the things that you've talked about today. So.
Okay, I am getting a signal, but I do have time for one more short question. Let's go to the back. We haven't gotten from this mic here at 3.
Yes, my name's Bonnie Newman. I'm from Calaveras County, a rural area in California. And my comments and observations are just that, not necessarily a question, but it may develop into a question. Knowing home care workers, almost 70% of us care for a family or loved one, and we have a turnover of approximately 30% of our home care workers pass on to a different job every year because our clients move on. Knowing that there's going to be a whole lot of us old guys needing care pretty soon, one thing that's come to my mind is the idea of including and embracing and retaining all of us trained home care providers to work into the private sector in a private pay situation, perhaps to avoid people having to go into IHSS as a last resort, but being able to care for these people on a higher level rather than being bedbound, and being able to work and use the skills that we've obtained and the resources that we've gathered in order to keep ourselves in the field that we've chosen and to keep people out of the IHSS system, which is going to be completely overwhelmed in about 5 years when I'm going to need the help.
Thank you, Bonnie. So again, we're not going to have time to get to all of the questions we knew, but please use the app to send us your questions, your thoughts. Also, you can send us an email or you can jot it down on a piece of paper and hand it to the quad leaders. It's time for us to exit stage, but you're going to take the next 15 minutes and discuss at your tables about what you've learned from this conversation about the future of long-term care work. What ideas do you have about the role we can play as a union as we move forward? And most importantly, what impacts on your family and your community are you thinking about? I really want to take the opportunity to thank Martha and Mike and Daniel for joining us. Let's give them a round of applause. And 15 minutes to your discussions.
Thank you.